Hi, I'm Dr. Dean St. Mart, formulator for supplement needs, and in this video we're going to talk about liposomal CoQ10. So what is CoQ10? It's the abbreviation for coenzyme Q10. Now this is a very potent antioxidant within our body. We can term it what's known as a pseudo-vitamin. So that basically means that it has vitamin-like effects in our body, but it's not essential. It still has vital effects in our body, but if we have a deficiency of CoQ10, it doesn't result in a diseased state. So that's what we technically term CoQ10 as a pseudovitamin. It exists as two forms, ubiquinone and ubiquinol. So ubiquinol is the reduced form, which a lot of people will probably be familiar with in terms of patented version forms of CoQ10. If we look at how much CoQ10 is in your body at any one time, there's approximately 2 grams total. And we need to replenish CoQ10 every day on average with about 500 milligrams. So it takes about 4 days to really replenish CoQ10 stores. Now, if we're taking statin therapy to control our LDL, or if we've suffered a heart attack, that can cause massive depletions in CoQ10 as a result of those cardiac events. So it might be vital for someone who has suffered the trauma of a heart attack to replenish their CoQ10 stores as quick as possible. Now we do get CoQ10 from our diet, so again that's why we term it a pseudo-vitamin. So what does CoQ10 do in our body? In simple terms, it aids in our mitochondria, specifically for energy production via the electron transport chain. It's a very lipophilic molecule, so it loves fat, meaning that it's very fat soluble. This can have issues when we ingest CoQ10 as an oral supplement because it has a very high molecular weight, which again can cause slow absorption and incomplete absorption in our small intestine, so we don't gain the full benefit of the full dose that we take. Now what we've done is we've created a liposomal version of CoQ10. If you've watched the liposomal glutathione or the liposomal curcumin video, you'll have seen exactly what a liposome is. But if you haven't, a liposome is a nanoparticle, specifically made from a phosphatidylcholine complex. And that's all scientific. In simple terms, it's a fat molecule that's nano-sized, and inside that nano-sized particle contains CoQ10. When we ingest it, because our body has a phospholipid membrane, a fatty membrane, that liposome can penetrate through directly into our cells, where it then gets lysed, which is burst open, to yield CoQ10 directly inside our cells to deliver itself either to the mitochondria or to other cells that may require it. Now, what are the benefits of CoQ10? As I said, this gets depleted with statin use, and it also gets depleted following a cardiovascular event. CoQ10 has many benefits, but more so specifically, especially for enhanced bodybuilders, it prevents lipid peroxidation. So it's going to lower your chances of oxidized LDL and potentially atherosclerosis. It can also improve blood flow and help support endothelial function. So what that ultimately is going to do is improve how your arteries are pushing blood through, because you can imagine our endothelial cells of our arteries are only one cell thick. So if they get damaged or they lose function, we can allow potentially for oxidized LDL to pass inside the artery and trigger plaque formation. So hopefully that gives you a little bit of insight into liposomal CoQ10. I'm Dr. Dean St. Mart, formulator for supplement needs, and thank you all for listening.